You wake up at 3 in the morning. Not from a nightmare, not from some noise next door. You wake up because it feels like your head is a balloon and someone's pumping it up from the inside. You're lying there, staring at the ceiling, afraid to get up too fast. Your wife's asleep next to you. You don't wake her up. Why bother? What's she gonna say? Check your blood pressure. You already know. 160 over 100. Maybe 170 over 100. You reach over to the nightstand, find a pill. Take a sip of water from that same glass that sits there every night, like it's on duty, and you wait. 20 minutes, 30, maybe 40, until the pressure in your head eases up just a little. Now picture something else. It's Saturday. Your grandson, he's 7, asks you to play soccer in the yard. He grabs your hand, pulls you outside. 5 minutes in, and you're out of breath. Not because your legs are tired, not because you're out of shape. It hits you all at once. Your face turns red. Your ears start ringing. Your heart is pounding like it's about to jump out of your chest. You sit down on a bench, pretend your knee is bothering you. Your grandson runs off to play with other kids, and you're sitting there thinking, I'm only 62. When did I get old? Sound familiar? If even one of these scenes hits close to home, then the next hour might be the most useful hour you've had in the past 10 years. Stick around. This video is for you. Good afternoon. Over the years, I've seen thousands of patients with high blood pressure, men, women, young, old. But there's one group in particular, men over 50, that's honestly both my biggest frustration and my biggest passion. Frustration because you come in late, when things already got bad, when your wife pushed you, when something happened at work and they had to call an ambulance. Passion, because when you finally start understanding what's going on in your body, the results can be incredible. Even I'm sometimes surprised. Today we're talking about high blood pressure, but not the way you usually hear it at the doctor's office. No complicated terms, no lectures, no, you should have come earlier. You're here now, and that's what matters. Here's what I promise you. First, you'll understand what's actually happening inside your body when your blood pressure spikes. Not textbook talk, but simple, clear, like we're sitting at a kitchen table. Second, you'll figure out which of the 3 main types of high blood pressure you have. Yes, there are different types, and they should not be treated the same way. Third, you'll walk away with a simple daily plan, morning, afternoon, evening, that you can start tomorrow. No waiting weeks for a doctor's appointment. Deal? All right, let's get into it. But first, let's address something I hear from every other patient. A belief that stops people from getting better more than the disease itself. It goes like this. Well, I'm 60. Of course my blood pressure is high. It's age. My dad had it. My granddad had it. It's genetic. Nothing you can do. Just take pills for the rest of your life. I hear this so often I sometimes feel like printing the answer on a poster. Because this is a myth. A dangerous one. Let me explain. Back in 2018, a large European study followed over 12,000 men aged 60 to 85. You know what they found? 23% of men over 75 had normal blood pressure, around 120 over 80. No medications, no special lifestyle, just regular retirees from Germany, France, the Netherlands. Now here's the key part. Among those with high blood pressure, in 87% of cases, there were clear fixable causes, not age, not genetics. Real specific issues, chronic inflammation in blood vessels, insulin resistance, magnesium deficiency, stiff arteries caused by lifestyle. I had a patient, 78 years old, former engineer, blood pressure, 165 over 105, 3 medications, and still not under control. We found the real issue, sleep apnea. He would stop breathing dozens of times per night. His body went into stress mode over and over, and his pressure shot up every morning. His wife had been telling him for 20 years, "You snore like a tractor." He thought it was funny. It wasn't. We treated the sleep apnea. He lost 8 kilograms. 6 months later, he was off 2 of his 3 medications. Blood pressure, 130 over 85, at 78. So remember this. This is not just age. It's a condition. And conditions can be treated, not just masked with pills. Now let's simplify how blood pressure actually works. No medical jargon, just plumbing. After 22 years, I can tell you, 95% of men over 50 with high blood pressure fall into 3 main types. I call them the plumbing problem, the fuel problem, the wiring problem. Type 1, the plumbing problem. Your blood vessels lose flexibility. Think of old garden hoses, left out in the cold for years. They're stiff, they crack, they don't bend. That's what happens to your arteries. Key signs: high top number, 160, 170, but lower number normal or low. Pressure builds during the day, peaks at night, cold hands and feet, ringing in the ears. Treat this wrong, and you feel worse, not better. Type 2, the fuel problem. This is about what's in your blood. Too much sugar, too much insulin, too many bad fats. Your blood becomes thicker, like syrup instead of water. The heart has to work harder. Pressure goes up. Signs: waist over 102 cm, 40 inches. Pressure rises after meals. Constant thirst. Frequent urination. Sleepiness after eating. Treat this wrong, and you risk diabetes. Type 3, the wiring problem. This is your nervous system. Your body has two pedals: gas, stress response; brake, relaxation. In this case, the gas pedal is stuck. Even when you're resting, even when you're sleeping. Signs: sudden pressure spikes, resting pulse over 80, trouble falling asleep, sweating, especially palms and feet. Treat this wrong, and you get rebound spikes. Here's a quick test you can do right now. Sit down, relax, measure your pulse, stand up, wait 1 minute, measure again. Pro 5, 10 BPM, normal. Pro 15 to 20, nervous system issue. Little or no change, plus dizziness, vascular stiffness. Now let's get practical. Here's what you can start tomorrow. What to cut out. 1. Hidden salt. Processed foods, bread, deli meats. This is where most salt comes from. 2. Evening carbs. Bread, pasta, sugar after 6 p.m. Morning pressure spike. 3. Screens before bed. They kill melatonin, no nighttime recovery, constant high pressure. Noa/dr. What to ADD? 1. Potassium. Bananas, beans, dried apricots helps flush excess sodium. 2. Magnesium. Pumpkin seeds, dark chocolate, relaxes vessels and nerves. 3. Breathing practice. 5 minutes, twice a day. Slow breathing lowers pressure naturally. Nasas kudur. Simple daily plan. Morning, 10 minutes. Glass of water, 5 minutes breathing. Protein breakfast. Day, 15 to 20-minute walk after meals. Simple hand grip exercise. Stay hydrated. Evening, no food, 3 hours before bed. No screens, 1 hour before sleep. Magnesium. If after 4 weeks your pressure is still above 150/95, see a doctor. No delays. Let me finish with this. That patient I told you about, Victor. A year later I asked him, what really changed? He said, it's not the numbers. It's that I can play soccer with my grandson again. Not 5 minutes, half an hour, and I'm not scared anymore. This isn't about blood pressure. It's about your life. Right now, you have a choice. Close this video, or take one simple step. Set your alarm 10 minutes earlier tomorrow. Put a glass of water by your bed. Start there. And I've got a small request. Drop your usual morning top number in the comments. Just the number. Then come back in a month and tell me the new one. Let's see what changes. Make sure you don't miss it.